Joining us now, Executive Director, Virginia Americans for Prosperity, Tyler Foote. Tyler, good to have you with us, man.
Hey, thanks for having me on, John.
Tyler, always a pleasure. I want to get, before we get into politics and Richmond and General Assembly, what was going on last night with the air raid siren? Have you ever heard that anywhere?
Yeah, I haven't heard that in quite some time. I'm from Kentucky, and every now and then we get those blasting. But I'll tell you what, I was in my hotel, which is on the 8th floor, and it was pretty crazy watching the wind just blow through these trees and blow through these signs. I was a little concerned that we were going to get some damage in downtown Richmond, but I think we were able to survive, luckily. So it was pretty scary though for a couple of minutes.
Yeah, there's about a 20-minute span there just to share with our audience. Now, of course, if you're in Richmond, you know exactly what was going on. But if you're not, one of the other areas of the state, we were under a tornado watch. And downtown, right in the Capitol Square, I mean, the wind was blowing and the rain was coming. Anyway, in Richmond, they have these tornado sirens, which is a warning sign, kind of like an air raid. And so they were going off. And that is an ominous siren. When it's dark and raining and you get the siren that's going off, pretty ominous. So anyway, everything turned out fine. I have to give my good friend Tyler here a big shout out. He has immersed himself inside of the General Assembly, and I met him in the elevator yesterday, and he was handing out information to senators and representatives on some of his issues, trying to get them to be sure they had all the facts before they made any decisions, and he's doing a fabulous job. And AFP is very lucky to have Tyler Foote here in Virginia. Tyler, we got some major things going up. I want to start with COPN, or CON, the Certificate of Public Need, which has been under fire. Now, it's been in existence for some time, and Republicans in the House and Senate, this thing is under fire because they say that it's outdated and it is restricting free market competition for certain hospital services. Now, the hospitals are saying, well, wait a minute. If you do away with COPN, then here's what happens. Then other medical facilities come in. They don't have to have a certificate of public need, which is a certificate that basically you have to justify why you're coming in. They can come in and they can cherry pick the most profitable services only, and that will hurt hospitals that have to compete with that and then have to provide all the free services under the law. And I know that, Tyler, you've been working on this for some time. How do you think it's a couple of these got through the House, getting to the Senate now? What's your position on it? How do you think it'll play out?
Yeah, well, first of all, thank you for the compliments that you gave me. I really do appreciate it, and it's fantastic to have this platform to kind of talk about our issues that are important to AFP and important to our activists. So, I really appreciate the opportunity. When it comes to COPN, it's got a tough road ahead because there's some serious opposition behind it, some powerful opposition behind it in the hospital associations, and a lot of these communities, you're looking at the hospitals and the school board as being the primary employers in these counties. And so, if you're a legislator and you have hospitals come to you and telling you that if you repeal COPN, you're gonna close the doors of our hospital, that's pretty alarming. But quite honestly, the facts don't bear that out. And more importantly, what we're finding is through many years of research that COPN regulations are actually hurting patients. So just to kind of give your listeners a quick background, these laws were mandated by the federal government in the 1970s. And the thought was that a surplus of healthcare services could possibly drive up costs. So these laws were put in place to try to regulate the healthcare industry and required healthcare givers, healthcare providers, that before they could expand access or add new services, they had to get the federal government's permission before they could do any of these things. But what happened is in the mid-'80s, the federal government realized this is actually bad policy. So they repealed that mandate that states have to have COPN laws. Some states, though, have left them in place, and that's where Virginia is today. We have 19 COPN laws on the books. We're actually the 11th most restrictive state when it comes to how we regulate our healthcare industry. And what the research says is that these laws actually decrease competition, decrease access to quality care, and then also increase costs. And a Mercatus Institute study from last year actually found that because of these laws, Virginians have 10,800 fewer hospital beds, 41 fewer facilities providing MRI services, and 58 fewer hospitals offering CT scans. So the laws that were originally put in place in the 70s to help increase access to care is actually doing the exact opposite and decreasing access to quality care, all because it limits the availability of competition in the healthcare industry. So what we're advocating for is, really full repeal of these laws, but we understand that, political reality probably doesn't allow that to happen. So what we're doing is we're supportive of Delegate O'Bannon's bill, HB 193, which reforms the COPN laws over a 1.5-year time span, and then also will kind of allow for the administrative process of applying for COPNs to be a little bit more smoother, time-sensitive, and also cost-effective as well. So, these laws actually, like I said, are hurting Virginians, specifically in rural areas, and so it's something that we want to see repealed so that we can get more competition in the healthcare industry so we can drive down costs.
Okay, so look, without debating the merits of it, because there's two sides to the argument, and one of the things that we're concerned about is if O'Bannon's bill were to pass in the Senate and COPN were to be repealed, that it would have a very negative impact on some hospitals in rural areas. One is already shut down, another one in Southwest Virginia on the verge of shutting down, so economic reality starts to set in. But it has passed narrowly in the House. It's going to the Senate where the battle is now, and your organization, AFP, has been very aggressive in getting people involved in this. And one of the things that AFP does, because you're nonpartisan and you're at the grassroots level really, is that you go straight to the people. Which is how you really, and I've always given AFP credit for almost single-handedly defeating Medicare expansion in this state with the effort that you made. But now we understand you've got a kind of a semi-ad campaign going on where you're reaching out to voters in key areas where key senators are with a message to pick their phone up and tell their senators to vote in favor of repealing COPN, right? And that's in the form of not traditional ads, but going directly to people over the phone and telling them to give them the facts as AFP sees it, and then getting them to actually reach out to their representative, right?
Yeah, so when it comes to an issue like COPN, it's obviously very complicated, very convoluted, and so what we're finding is that a lot of constituents, or a lot of citizens rather, aren't really familiar with the issue. And candidly, if you have this conversation with a lot of legislators, they'll probably tell you the same thing, that prior to about a year ago when these conversations really started, they weren't familiar with COPN either. And so, in order for us to, to have an impact on this and make sure that we're, looking out for the best interest of Virginians, what we're trying to do is we're trying to educate citizens on this issue and encourage them to take action on it. So, the calls that we're placing into legislators' districts, they're all educational, very positive language. We're not demonizing any legislator at all because we understand it's a very complicated issue. But we're educating their constituents and then encouraging them to take action and ask their senator to vote for repeal. So it's the feedback and response that we've gotten so far, again, has been really positive. I think people are thankful that an organization like AFP is looking out for their best interests because, let's be honest, a lot of times, citizens feel removed from the political process. And so, our organization is able to kind of plug those guys in, give them a voice, and give them the opportunity to have their voice heard and advocate for their best interests directly to the legislator's office. And that's a pretty powerful tool that we're excited to be using.
It is a very powerful tool, no doubt, because you're reaching directly into the homes or into the mobile phones of people and trying to give them the facts and then immediately saying, hey, this is the number to call your state senator or your state representative, whatever that may be, and then you guys actually patch that right through, right?
Absolutely, yeah. And let me take a second to actually highlight something here. We always say that politics makes strange bedfellows. And
Yes.
when it comes to COPN, that's definitely the case. You look at, who supports repeal. Last year, the U.S. Justice Department and the Federal Trade Commission urged Virginia lawmakers to reform our system because they find that it stifles innovation, hinders customer choice, and also weakens markets' ability to contain healthcare costs. So when you have the federal government who once mandated these laws is now saying they need to be gone because they hurt consumers, that's pretty impactful. And then the other thing is that the Richmond Times-Dispatch, of all places, also supports reform or repeal of COPN laws because, again, it hurts consumers. So when you look at, the coalition that's behind reform, it's a pretty strong coalition and also a bipartisan coalition of different groups and organizations that I think have a lot of sway and a lot of voice. So it's an exciting time to be working on this issue. It's like I said, very convoluted, very complicated, but I think we're making some headway. And what I would like to encourage your listeners to do is call your senators. This passed the House, it's in the Senate now. Call your senators and tell them that you support HB 193 and that you support reform of COPN. And that's the biggest impact that your listeners can have, because they're hearing from one side. They didn't make sure they hear from the grassroots, from people that this actually affects on a daily basis. And if they do that, if your listeners are able to do that, then I think that'll have a tremendous impact on how this all plays out.
So Tyler, as we know, this goes into the Senate right now. COPN, Certificate of Public Need. The hospitals in Virginia have really come together in opposing repeal of COPN. Why?
Well, I think any time that you try to disrupt the status quo, you're going to have people that come out against it. And the funny thing is that even the hospital associations understand that the status quo is not acceptable. Common argument that I hear is that the healthcare industry doesn't really have free markets, and I completely agree it doesn't. But what you're saying then is if you're not for COPN reform because the healthcare industry is not free market oriented. What you're saying is then you basically, in order to inject the free market into healthcare, you're asking for a wholesale reform of the way our healthcare industry works, which starts at the federal level and then comes down to the states. To me, that's the ideal situation, right? I mean, I think we can all agree that our healthcare system needs to be redone from the top down. But that's a bigger pill to swallow, and probably is not going to happen anytime in the near future. So let's take baby steps where we can. And reforming COPN is an opportunity, is a baby step in the right direction to inject free market principles and competition in the healthcare industry. And anytime you do that, people that are currently in favor of the status quo, that's going to aggravate them, that's going to scare them. But the same people that are saying we're going to shut our doors if COPN is passed were the exact same hospitals and associations that were saying we're going to shut our doors if Medicaid expansion wasn't passed. And they're doing totally fine. Studies have come out from a couple of different organizations that talk about how the financial health of our hospitals, both rural and urban hospitals, are fine. And the profit margins are growing in some cases. So, I don't want to say it's a lot of, boy who cried wolf, but it's certainly a situation where we've heard this time and time again, that if you pass Medicaid expansion, we're going to close our doors. That didn't pass, and it's fine. And so I think the same can be said for COPN reform, and we just got to make sure to stay strong on our principles and that what we're doing is right.
So what would you say to the hospitals in rural areas that are not making the kind of money that you talked about? One of them just closed. One other one, Catawba's on the block. I mean, if they can't make money, they're just going to go away. People don't stay. I mean, if there's anybody that understands the free market, it's Tyler Foote, AFP, right? So companies that own hospitals, they're not just going to continue to lose money. They're just going to do what's been done in Virginia and Georgia and other states. They're simply going to close, and then people don't have access to care. Coupled with the facts that it puts people out of work, there's no jobs, etc. So, I get a lot of what you guys are saying on this, but that's my concern that, okay, we were against Medicaid expansion. That makes sense. That hurt the rural hospitals. Now we want to repeal COPN, which is going to take away their opportunity to make money in certain areas to compensate for the mandated services they have to provide to lose money, which they're insured to lose money. And so then if they're not making any money, they simply close. And then what good does that do? That doesn't do anybody any good.
A couple thoughts there. Number one, when it comes to the specific language in the bill, HB 193, I want to be very clear about this, that there is a carve-out for rural hospitals. So, I think Delegate O'Bannon, who's the sponsor of this bill, has been really gracious and heard the concerns of the rural hospitals and has decided, okay, I'm understanding and sympathetic to their situation, so we're going to take them out of this bill so that they aren't affected. So there's a carve out to protect rural hospitals. There's also provisions in the bill to protect them to protect against cherry picking. But let's pretend for a second that carve out and those provisions weren't in the bill.
Tyler, we're going to have St. Patrick's. They're a little cocky, so we're going to have to put them in their place on Friday night at 7:15. I'm like Joe Namath in the 1969 Super Bowl. I guarantee a victory on Friday night. Backed by popular demand. Tyler Foote, Executive Director, Virginia AFP, and just in the middle of a very inspired discussion on Certificate of Public Need, now becoming a household acronym in Virginia. Nobody heard of it 6 months ago. Now it's on the tip of everybody's tongue. They get up and they say, what's going on with COPN today? Right? I know. I get it. So, Tyler Foote, we had to cut him off there to get the bottom of the hour news and all that good stuff. Just when he was telling us that there's a provision to save rural hospitals from death over COPN. Now, you got about 5 more minutes, Tyler. Expound on that, if you would.
Absolutely. So, as we were talking about before the commercial break, in HB 93, which is the main vehicle for COPN reform now, there is a carve-out for rural hospitals and provisions in the bill to protect them from cream skimming or cherry picking. So, the concern over rural hospitals, hopefully will be alleviated with that carve-out and with those provisions. But what I was just about to get to, which I think you'll find interesting, is that let's pretend for a second that carve-out didn't exist. And the cherry-picking argument still was around, which basically, the rural hospital's biggest concern is that people would cherry-pick selective services that are more profitable, less complicated, and well-insured services that the outpatient surgery centers can offer, and basically leave the rural hospitals with just a charity care. And so the Mercatus Institute put out a study last week, so brand new, hot off the press study. It actually shows that despite the express goal of ensuring that rural populations have access to quality health care, COPN states have fewer hospitals and fewer outpatient surgery centers on average, and then even more so, fewer outpatient surgery centers and hospitals in rural areas than non-COPN states. So what the research shows is that, cherry picking isn't really a solid argument for rural hospitals to use because they have less hospitals by 30%, and also less outpatient surgery centers by 13% compared to states that don't have the COPN laws. So again, this all goes back to, what's best for the patients. As an organization, AFP, isn't here to help support the hospital's bottom dollar. We're looking out for the best interest of the patients, and that means that getting rid of these burdensome regulations that hinder competition, access to quality care, and increase costs. So that's I'll make sure that you get a copy of the study, John, because I think you'll find it interesting, and I know that's one argument that you're really concerned about. The study shows that cherry picking really isn't a concern, and in fact, these laws, really decrease the number of hospitals and outpatient surgery centers in rural hospitals when compared to states that don't have COPN laws.
All right, we're going to give you, Tyler. Normally I get the final word, but because you've worked so hard on this and the General Assembly, and I get, again, compliment you for getting into the weeds and really understanding these issues and getting in front of members to advocate your position for AFP, I think, is commendable. So we're going to give you the final word on that, and we'll see how it plays out. Tyler Foote, Executive Director, Americans for Prosperity. By the way, AFP, a founding sponsor of the John Fredericks Show. I can guarantee you this, we would not be here had it not been for Americans for Prosperity's belief in me when I first had the vision of doing a network in Virginia. Without them, I wouldn't be here today. We want to thank Tyler Foote. More information, AmericansForProsperity.org. Tyler Foote, the only person in history on the John Fredericks Show to get the last